Look at the rolling hills and coastline of Batanes. It is stunning. But for the people living in these geographically isolated parts of the Philippines, that same beautiful geography creates a harsh medical reality. Imagine a patient walking into a rural health unit. They are complaining of severe chest pain or exhibiting the early signs of a stroke. The local doctor usually knows exactly what protocols to follow. The breakdown happens because they literally cannot see what is happening inside the patient's body. In these island communities, the sheer inability to access timely diagnostic imaging turns the landscape itself into a fatal barrier. Let's look at the numbers. The Philippines has a population of over 118 million people, spread across thousands of islands, but only about 1,200 certified radiologists. That leaves us with roughly 2 radiologists for every 100,000 citizens. This chart compares that ratio internationally. While the Philippines sits at 2.0, Singapore has 7.6, and the UK has 8.5. Even those countries are dealing with workforce shortages, which puts the Philippine deficit into sharp perspective. The hardware deficit is just as steep. This gauge shows the national equipment supply. There are only 1,112 X-ray machines across the country, filling barely 30% of the projected national need. If a patient needs a CT scan or an MRI, those resources are heavily concentrated in major urban centers like Metro Manila, Cebu, and Davao. For millions of residents outside these cities, a functioning public health network is simply not an immediate, realistic option. The infrastructure is entirely absent. The breakdown of rural healthcare happens through a sequence of compounding failures. It starts with a distribution gap. Essential imaging machines are locked inside central hubs, completely out of reach for the outer municipalities. Next is the workforce gap. Even in regional centers like Cebu, a handful of radiologists serve millions of people. This severe lack of specialists creates a crushing backlog, where simple X-ray results can take up to 8 months to process. Then we hit the connectivity and system gaps. Unstable power ruins basic telemedicine attempts, and because paper records are siloed, a local scan has no pathway to a provincial hospital unless a patient physically carries it there. Finally, the financial gap. The public health system is nominally free, but making that multi-day trip for a scan means paying for travel, accommodation, and lost wages. By the time an image is captured, analyzed, and returned to the rural clinic, the clinical window to effectively treat a tumor or a fracture has closed. A potential solution is currently operating in Batanes. The Philippine Charity Sweepstakes Office recently deployed portable, AI-driven X-ray systems, technology evaluated by NASA, to serve the island's population. This hardware tackles the distribution gap directly. It operates entirely on battery power and can process up to 200 scans a day right in the local barangay, bypassing the need for a major hospital facility. The second component is an AI triage layer. The software instantly analyzes the image to detect 32 specific pathologies, like tuberculosis, flagging the most urgent cases for immediate attention. Instead of reviewing every normal scan, this system transmits only high-priority, AI-flagged images to a city specialist for final review. One urban radiologist can now oversee diagnostic imaging from multiple remote provinces simultaneously, without ever having to get on a boat. Mention AI in healthcare, and you will immediately encounter the fear that machines are going to replace human doctors, or that algorithms shouldn't be trusted with medical decisions. This chart shows the reality of clinical deployments. When a radiologist pairs with an AI tool, report efficiency jumps by 40%. The error rate line stays perfectly flat, because a human doctor still verifies and signs off on every single report. But we also have to evaluate this through the reality of rural healthcare. For a patient in an isolated community, the alternative to an AI-assisted diagnosis is not a human doctor. The alternative is no diagnosis at all. The demand for medical imaging is growing, but the radiologist supply is not keeping pace. Relying on technology is the only mathematically viable way to bridge that gap. If we have a tool that can cut the time it takes to diagnose a patient from months down to minutes, the debate shifts. The question is no longer whether we should adopt it. The question is how long we can afford not to.